We will start first with the CNBC and Dawn from CNBC. Dawn, can you hear us?
Hi, yes, can you hear me?
Yes, please go ahead.
Okay, thank you for taking my question. I am calling from quarantined in New York City. My question is that the fatality rates in Italy and the United States, especially Italy, are significantly higher than in Asia, and it appears that that may be the case in the next few weeks in the U.S. I've seen research reports on ACE inhibitors and ibuprofen affecting this disease. Is there anything in the diet, the lifestyle, the typical drug protocols that Americans or Europeans use that make this virus more severe?
I can begin, and Maria can follow up. Certainly the experience in Italy and a large number of patients were questioned on their use, for example, of ACE inhibitors, and there was absolutely no association on the use of those ACE inhibitors on having disease or not, or having severe disease, more importantly. So now, obviously, we need to gather more evidence, but the evidence thus far would indicate that these antihypertensive drugs that are used, many people are on, do not appear to have any impact on the severity of disease. With regard to the reasons why we have different mortality in different countries, a lot of it's mediated by two factors. One, the age profile in those communities. Populations that have older populations, or a higher percentage of people in the older population, it may not be that the overall case fatality is different, it's just that case fatality is higher in that older age group. Equally, the presence of underlying conditions in those individuals and the incidence of underlying conditions in those individuals can also lead to worse outcomes. So you have a lot of issues that have to be factored in when you try to work out why one country's mortality rate is higher or lower than another's. And obviously as well, and this has to be taken into account, that systems that come under huge pressure, systems that are overloaded with fatigued doctors and nurses, with many, many sick patients at one time, clearly the outcomes for those patients can be worse. That's what we've been saying, and many countries are trying to do. We need to take the pressure off the healthcare system. We need to reduce the tsunami of patients coming through the door to give doctors, nurses and other carers the opportunity to save more lives. We can only do that if we pressure the virus and put it under pressure, reduce the incidence, and get back to a situation where we can deal with this virus within the healthcare system in an effective way. Maria?
Thanks, Mike. The other reason why it's challenging to compare mortality rates is because indeed it is a rate which you are calculating on any given day, which means you are looking at the numbers of people who have died divided by the number of people who have been reported in that country. And so there are significant differences in terms of the activities that areas are doing to identify cases based on the epidemiology, based on the transmission scenario that they're in. And in many situations where systems are overwhelmed, they're focusing on severe cases, and those are the cases that are being detected, and you're missing mild cases or unrecognized cases that may be in the community. And so that could lead to a higher number of a mortality rate. At the same time, you have individuals who are still in hospital that are developing, either progressing to more severe disease, and some people who are experiencing severe disease will have advanced treatments. They could be on ventilation, they could be on ECMO, and it will take some time for them to either recover or to die. And so it is very difficult and misleading to be comparing mortality rates. What we really need to be focusing on right now are what is the age profile of people who are in ICU. We've talked about this before. We're seeing more and more individuals who are of the younger age group, in their 30s, in their 40s, in their 50s, who are in ICU and who are dying. Overwhelmingly, we do see a trend across countries that people who are older, people who have underlying conditions, will have more advanced disease. So if the population that is affected have those characteristics, then you'll have a higher risk of death. But we have some time to go before we can really understand what mortality looks like across different countries. So I would urge you to take those mortality rates with caution when comparing across countries.